Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellness Way affiliate in Yorkville, Illinois. Hope you guys had a great Monday evening. I apologize, I'm going a little bit late. Had a couple of things to finish up last minute, but I always appreciate you guys joining us. And hopefully what I'm going to go over tonight, you will get tremendous benefit from. And if you do, make sure, guys, you please share this video. I think this is really important, especially when we start staying current when it comes to current events and some of the things that are coming out in regards to health. So as every week, I'm going to give you my opinion regarding something. And we're going to try to use facts, we're going to try to use evidence, and to help you guys make an informed decision when it comes to your health. And we're going to look at things from a little bit of a different perspective. And guys, if you're joining me right now, make sure you say hello, and also make sure you let me know where you are watching from. Hello, Canada. Hello, Australia. Hello, all of the almost every state in the United States. Europe as well. Actually from the Philippines. So thank you guys always for watching. Thank you for your likes. Thank you for your shares. And thank you always for commenting. I appreciate that. I actually read all the comments. I know I can't necessarily respond to specific health questions and things like that, but just know that I read every single comment. So thank you guys very much for joining me on this Monday night. I know you probably have a lot to do and the weather might be beautiful and you'd rather be outside, but you're here with me. So thank you again. So tonight I'm going to go over this. Is this new drug that's made by Pfizer, so just pay attention to that. Is it the new answer to COVID, et cetera, et cetera? Okay. Now, if you don't know, it's called Paxlovid or Paxlovid, depending on who comes up with the pronunciation of it. But this is a new antiviral drug, specifically that Pfizer has made, and it is under FDA emergency use authorization. And this is now the treatment to prevent hospitalization for people who would benefit from, who are immunocompromised, who have risk factors, who are advancing in age, in order to prevent hospitalization and death. So is it actually the new answer to COVID? I'm going to give you my opinion in just a second if you guys are joining me and saying hello. Guys, coming up now 4 weeks from last Saturday is going to be our Man Up event. And so we're going to be showing men specifically how to increase your testosterone without the gimmicks. I see the gimmicks all the time on radio, on television, perusing, Facebook, about, male fertility, male, enhancement, improving male hormones. And guys, I'm going to tell you, really a lot of the clinics that are promoting this are doing a this for that approach, meaning we're going to measure your testosterone. We're going to give you testosterone if it's low without actually looking at hormones a lot deeper and without also digging into some big lifestyle factors that are influencing a man's testosterone. And it doesn't matter how old you are. If you got the machinery, you have the ability to be able to produce testosterone, but there's a lot of different lifestyle factors that are going to get in the way. And we're going to cover that at that event, July 23rd, 10:30. This is an in-person event. And if we do have enough people, we'll then open it up and possibly have this broadcast it live so that we can watch and have also an online option so that people can take part in what I'm going to say men, can take part into what we are going to be doing over the 4 weeks when it comes to specifically diet and working on some of the biggest influencers of a man's testosterone. And it has to do with sugar, it has to do with fasting, it has to do with their insulin levels, it has to do with the way that they exercise, and we're going to be covering all of that. And so this is going to be an immersive in-person event afterwards. We'll let you guys know as far as the cost, as far as what to do. A lot of it is dependent on the number of people that we have, but we're also going to be doing something really important, which is going to be self-defense, the ability to be able to handle a firearm and be able to handle it correctly under pressure, which I think in this environment is actually very, very important when you look at some legislation that is actually passed. So you do need to be able to protect yourself. And so guys, if you are from the Chicagoland area, make sure you go to the top of this page and you're going to see the Eventbrite link in order to register for it. We are capping it out at 30 people, and I know I just checked the registration. I think we got 4 or 5 more people today. We still got about 3.5 weeks, but please, 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 if you are coming to it, make sure you get registered as quickly as possible, because as soon as we get to that limit, we will open it up for online for people who are actually out of state and out of the country. And we are working on an option that men can be able to follow along with that too. So make sure that you guys get registered for that. Okay. Now, the reason why I'm going to go over this is that across my email, I saw from Helio News, which really just cites all the latest medical journals as far as some of the things that they found that are very current to healthcare today. And this came across my email, and it was really interesting because the title of it was from June 21st, 2022, study finds Paxlovid reduces risk for severe COVID-19 and death by 46%. And if you look at it on the surface area, or on the surface, you're going to say, oh, that looks pretty good. Maybe this is a new and emerging and a very efficacious type of drug. But you have to start looking a little bit further, and I'm going to show you how, especially when they talk about a drug's treatment efficacy and how they actually skew data to make it look way more effective than actually it really is. I'm going to show you this, and this also pertains to a lot of other medications as well. So when you look at this at the surface and they say Paxlovid lowered the risk of severe COVID-19 or death by 46% in a study of patients in Israel, was especially effective among older or immunosuppressed patients or patients with underlying neurological or cardiovascular diseases. So they're saying severe COVID-19 and death by 46%. And on the surface, a lot of people are going to read this, breeze over it, and they're going to say, well, this is amazing. I guess this is going to be, within a new treatment regimen for COVID-19, et cetera, okay? So I went to actually the manufacturer of this drug, which consequently is Pfizer, by the way. Really interesting, because when you look at the other things that they produce, they don't have necessarily a tremendous history of being very honest about the efficacy of their drugs, about the side effects of other drugs. Remember, you can actually go and you can see how much they have been fined just within the United States over the last 20 years by actually promoting a drug that's not as efficacious as they claim it to be, or they hide the side effects, and it is in the billions of dollars. So anytime when you see this, you're like, okay, sometimes it's like create the problem and then also, offer the solution to the problem that they actually can create. So when you go to Pfizer's website, here's what they actually say, that Paxlovid is an investigational medicine used to treat mild to moderate COVID-19 in adults and children 12 years of age and older, weighing at least 88 pounds, with positive results of direct SARS-CoV-2 viral testing, and who are at high risk for progression to severe COVID-19, including hospitalization or death. Now, the first thing is I always want to ask, okay, well, is the SARS-CoV-2 viral testing, is that necessarily accurate? That is one thing that could be open to debate quite a bit. And the other thing is who are specifically at high risk for progression of severe COVID-19? How are they measuring whether a person would be considered high risk or not? Are they actually doing a full white blood cell count with an expanded lymphocyte enumeration, in which they're measuring CD4, CD8, CD19 natural killer cells? Are they actually measuring that to see if they have enough immune cells to actually be able to fight off any kind of viral infection or not? So what is their criteria to actually see that those people necessarily are at high risk? Because the people who are going to be at high risk you can actually directly measure an immune response as a result. Now here's what's interesting in what they said. Paxlovid is investigational because it is still being studied. So this has emergency use authorization by the FDA, which says we don't need to approve it. We're going to basically fast track it because, the pandemic is so severe that we don't have time to go through the proper quote unquote trials to see if it is safe or effective or both. So they said it's still being studied. But here's what's interesting, is there is limited information about the safety and effectiveness of using Paxlovid to treat people with mild to moderate COVID-19, et cetera, et cetera. So basically what they're saying is they're saying, well, we have to use it in order to see how well it works. We also have to use it to see how safe it is. It's kind of like saying, well, we have to pass the bill to see what's actually in the bill, which doesn't make a whole lot of sense. So Pfizer is actually admitting this right on their website. Now, here's what they say. Possible side effects. These are possible side effects that are actually known, but they're not going to know all the side effects because, well, they really haven't done large-scale trials on it. So it can have allergic reactions of hives, trouble swallowing and breathing, swelling of the mouth, lips, or face, throat tightness, hoarseness, skin rash, which is like considered an anaphylaxis type reaction to the medication. The other thing is that it can cause liver problems. So tell your healthcare provider right away if you have loss of appetite, yellowing of your skin, whites of your eyes like jaundice, dark colored urine, pale colored stools, and itchy skin, which can be a sign of some kind of gallbladder or gallbladder blockage, or stomach area abdominal type pain. Okay. Other possible side effects include altered sense of taste, diarrhea, high blood pressure, and also muscle aches. Now, here's what they say. These are not all of the possible side effects of Paxlovid. Not many people have taken Paxlovid. Serious and unexpected side effects may happen. Paxlovid is still being studied, so it is possible that all of the risks are not known at this time. You heard it right from the horse's mouth that they're saying not a lot of people have taken it, but we have emergency use authorization in which a lot of people who are considered high risk will be taking it, and they are going to be the trial. Okay. Now, I actually got this from a law website, okay, personal injury law website. And the reason why is they're going to be really on top of personal injury claims when it comes to FDA recalls for specific drugs. And here's what they say, okay, FDA recall statistics. While the FDA's mission is to protect consumers, many previously approved items have resulted in recalls, long-term injuries, and lawsuits, calling into question the efficacy of their approval process. Drugs alone, now listen to this, drugs alone have averaged 1,279 recalls per year since 2012. 1,279 recalls per year since 2012. The reason why I say this is, remember, this has to do with drugs that have been approved, the rigorous approval by the FDA, yet we're dealing with a medication that has not even been approved, but instead has emergency use authorization instead. So it hasn't even gone through the approval process, and despite that, over 1,200 medications are recalled every single year that have been approved by the FDA. So let's go back to this study that finds Paxlovid reducing risk for severe COV, et cetera, and death by 46%. Now, when you say 46%, you're going to think, if I take it, I have a 46% less chance of dying. That's not necessarily true. Because remember, whether you take this antiviral or not, there's still, let's just say conservatively, 99% of people actually survive whether they're on the medication or not. So whether they take it or whether they don't. So when you look at this, one of the things that you have to ask with any kind of medication, I'm going to go over an interesting example in just a second, you should be asking your doctor, I don't care about the percentage and how you can skew statistics. What I want to know instead is for this medication, what is the NNT? What is the NNT, doctor, otherwise known as the number needed to treat in order to prevent the intended effect or the intended consequence? So what do I need to, like, how many people need to take this medication in order to prevent this outcome? Okay. I'll give you an example when you look at cholesterol medications. The NNT actually can range, but it can conservatively be estimated that the NNT, because you take it to prevent a heart attack and stroke, the NNT is actually 100, which means 100 people need to be on this medication in order to prevent one heart attack or one stroke, which gives it an efficacy rating of 1%. And I don't know how many people would be lining up at the door, banging the doors down, saying, give me that medication that has a 1% success rate. And in fact, when you look at the number of people who have side effects, which can be conservatively estimated at 15 to 20%, then you're looking at the risk far outweighing any kind of benefit. But not only that, when you look at cholesterol, it's actually been proven that cholesterol doesn't cause heart attacks. Otherwise, only people with high cholesterol would be having heart attacks. But you have people with low cholesterol with heart attacks, no cholesterol, like normal cholesterol with heart attacks, people with high cholesterol having heart attacks, and people with high cholesterol who are never having heart attacks. So does cholesterol actually cause heart disease? No. There's other factors that have to be involved with this. So let's get back to this medication and how they'll skew numbers and statistics to say that there's a 46% less risk for dying or having severe effects of COVID-19. So let's just look at this. This is a very simplistic example. I apologize, but hopefully it can give you guys the idea. Let's say they took 10,000 test subjects that were treated and not treated. So here you have the same amount of treated and untreated test subjects. And then when you look at the ones who got the medication, there were 54 deaths at the end of the trial. And the untreated, there was 100 deaths. So you look at this and you look at actually the number of deaths within 10,000 people is not that much different. But they look at this and they say, well, the person that got the medication had a 46% lower risk because there was less deaths. But the problem is when you look at the number needed to treat and you look at the difference between that two and you're dividing it actually into the number of total test subjects, the number needed to treat would actually be 217, which means 217 people needed to be on this medication in order to prevent one death, which actually gives it an actual risk reduction of 0.461%. So what that means, 217 people need to be on this medication in order to prevent one death. One death, that's it. That doesn't take into account the percentage of people who are experiencing side effects. One of them could also be death as well, because they haven't actually studied this drug long term to see if there is some kind of side effects after 5 days, 10 days, 15 days, or heck, even 2 years. Who knows? What no one does, because it hasn't been studied. So if I said, hey, the actual risk reduction is 0.46%, how many of you would be banging down your doctor's door demanding this solution that's going to give you a 0.46% reduction risk of death when you're taking this medication? So this is actually when you're saying there's the published media statistics, and then there's actually just the real statistics when you start looking at the math. I'll give you guys another example, because a lot of you probably have heard of taking an aspirin every single day. And if I said, hey, when you're supposed to take an aspirin every single day, what's the reason why? And you would say to prevent a heart attack or a stroke. Well, I went to what's known as thennt.com, which again, NNT stands for number needed to treat, thennt.com. And it goes over a lot of the common medications that people are taking, and it's looking at the real statistics. What is the number needed to treat in order to prevent a heart attack and stroke? Because when they say it reduces your risk of a heart attack by 33%, again, they're using the same manipulated statistics. You always ask, what is the NNT? So here is when it comes to taking an aspirin every day for an entire year, it helped 1 in 1,667 people to prevent a cardiovascular problem. As far as preventing death, 0. 1 in 2,000 were helped to prevent a non-fatal heart attack, and 1 in 3,000 were helped to prevent a non-fatal stroke. So when you look at the actual statistics, that looks pretty abysmal. Now, when you look at harms in NNT, 1 in 3,333 were harmed by having a major bleeding event. You may look at that and say, okay, well, that's not bad. That's a major bleeding event, like having a hemorrhagic stroke. But here's the interesting thing, is when you do take an aspirin every single day, you are going to cause problems long-term in your stomach, and you're going to cause a lot of gastrointestinal bleeding long term, and you're also going to cause a lot of stomach and a lot of intestinal problems. See, one of the things that you'll do in order to break down the gastrointestinal barriers is taking aspirin, okay? So that's just not taking into effect some of the things that can happen when you are bleeding a small amount every single time that you are taking an aspirin, like anemia, for example, okay? So those people that were taking an aspirin every single day, I'm like, well, here's the statistics, yet some people can't get over it because it's just what their doctor told them. It's just what we've done all along, which goes back to my example of why people cut the ends of the ham off of the ends of the ham and for Christmas. And it came down to, well, because it used to not fit in the oven, but we still did it because that's just what mom did, that's what grandma did, that's what great grandma did. We don't know why we do it anymore. We just do it because that's what we always did. So 1 in 1,667, which makes you wonder, what on earth are we doing in healthcare especially? So later on in this article, here's what they included. They included in their study patients at high risk for severe COVID-19 with no contraindications for Paxlovid, okay? Now, it's authorized for use in the United States. Now, here's the thing, is no contraindications for Paxlovid. And I'm going to show you that there are a lot of people who have contraindications for Paxlovid, okay? They say do not take Paxlovid if, okay, and they go through all of these different medications that they should say do not take this if. And I came across something interesting with which a lot of people are actually taking, is they're taking lovastatin or simvastatin, which is a statin medication, otherwise known as a cholesterol-lowering drug. You mean to tell me that the only people that they tested were not on a statin drug, and how many people who are at risk for having severe COV, et cetera, are actually on a statin drug? And tell me something, are they screening these people to make sure that they're not on any kind of statin drug? Which last time I checked in the United States, not in Israel, in the United States, there's a lot of people that are taking these drugs because they have quote unquote high cholesterol. But here's another interesting thing too, that is a contraindication for taking this medication, okay? So contraindication means you can't take it. So co-administration with drugs that are highly dependent, now listen to this, CYP3A enzymes for clearance and for which elevated concentrations are associated with serious and or life-threatening reactions, okay? Now, also co-administration with CYP inducers were significantly reduced. This is the name of the medication. Plasma concentrations may be associated with potential for loss of virologic response and possible resistance. So what they're saying, guys, is if you look at specifically these groups of enzymes within the body, most of them are concentrated within the liver, these CYP3A. Enzymes, most are concentrated with the liver, some are in the gastrointestinal system, some are actually within the brain. And they're saying, if don't take these drugs, if you have, cannot clear these drugs out the way that you're supposed to, because you might be taking a medication that is slowing down this process, which will actually hurt you. Now, yes, there can be medications that can slow down this process, but a lot of people, actually, this process is slowed down in the liver for other reasons. I'm going to show you a brilliant example, but they're saying if this drug, your ability to be able to clear this out is inhibited, then this is a contraindication. The question always comes to is, are they actually looking at these concentrations and the ability of this person to be able to clear out this medication? Now, how do they know whether this is contraindicated? Are they actually asking people what medications they're on, number one? Number two is, do they know the liver health of these specific people? Because remember this, the people who are at highest risk are going to have morbidities, and the biggest risk was actually obesity, insulin resistance, blood pressure medication, and that's not even going into testing their immune system. So I came across an interesting article from PubMed, and it said this: CYP3A activity and expression in non-alcoholic fatty liver disease. Now, in the United States, they've estimated That's 66% of everyone in the United States has some level of non-alcoholic fatty liver disease, and this includes kids. So the reality is you can look at some blood tests and you can see, yep, you probably do have a fatty liver, especially if your triglycerides are all in the triple digits. So when you look at this, here's what they say about these CYP3A enzymes, which are involved with medication clearance. They're also involved with hormone clearance as well. Here's what they say. Hepatic or liver CYP3A4 mRNA expression in non-alcoholic fatty liver disease was 69% lower than control livers. So they say that CYP3A activity is reduced in human non-alcoholic fatty liver disease in addition to mouse and in vitro cell models of the disease. So what are they saying? That if you have non-alcoholic fatty liver disease, you have 69% lower expression of these enzymes in order to be able to clear out medications. But I'm going to show you something that's really interesting as well, is because this enzyme pathway is also involved in the conversion of estradiol into estrone and estriol, which is a weaker form of estrogen. Okay? There's no such thing as estrogen. Estrogen describes all of the different estrogens. So if you look at this person right here, you can see high amounts of estradiol, very, very low amounts of estriol, a weaker form of estrogen. And you know what? When you look at this, if they have a hormone profile that looks like this, I'm going to tell you one thing. This person has endometriosis. You can measure the different types of estrogens to see how they are metabolizing. So if this person does not have these enzymes because of non-alcoholic fatty liver disease, liver inflammation, GI inflammation, you name it, which will lower this enzyme activity, they won't be able to convert their estrogens into their weaker form. And guess what? They're going to have a really, really bad day when it comes to their hormonal health and their menstrual cycle. Now, here's what's interesting, guys, is that there are herbals that can actually speed up or restore these pathways back to sufficiency. One of them that actually helps to induce this pathway is known as St. John's wort. And I know what you're thinking is you're saying, oh, that's an antidepressant, isn't it? No, it's not. And in fact, it is an inducer of this pathway, which has the ability to work on the brain. But you know what else it has the ability to work on? Your hormone conversion. So how many people would have thought, oh my goodness, St. John's wort might be able to help people with endometriosis, but how are you going to know if it's going to help or not? You have to test. See, right now I can almost see people writing this down and going to the health food store trying to get St. John's wort, but guys, don't do it unless you have been tested. And there are some contraindications, because if someone is on an antidepressant, for example, you do not want to induce this even more, because you'll clear out your antidepressants a lot sooner, and you can actually have what is known as serotonin syndrome as a result. This is why you got to be very careful with doing some of these things, and you don't want to be just taking this for no reason. You have to work with someone who knows what they're doing. That's why, guys, you work with a Wellness Way doctor. If it's me, awesome. If it's another Wellness Way doctor, even better. Find one that is close to you or who can do remote consults when it comes to this. But this is a perfect example of someone who's going to have other issues, and this should be contraindicated as far as them taking Paxlovid. But are we actually testing these things sufficiently? Okay. Now, going on to this, in the same study that I quoted earlier on, they also found that the effect of Paxlovid was seemingly more significant among older patients, immunosuppressed patients, and patients with underlying neurological or cardiovascular disease. Well, this doesn't take a rocket scientist to understand is that this is an antiviral. So if someone is immunocompromised, it means that they don't have enough immune cells to be able to kill off virally infected cells. So what's the other alternative? Prevent the virus from replicating within the cells so that the immune system has time, even if it is suppressed, to be able to keep up. So that way the virus isn't going in and infecting more and more cells. So what they're just doing is decreasing a viral load. So the question is who are the immunocompromised? Who are the people who are immunocompromised? Remember, you can measure this. It's not just doing a white blood cell count. That's at the tip of the surface, because when you are looking at what controls a viral response, you should directly be looking at natural killer cells and CD8 cells. These are your cancer-killing cells. These are your cells that are infected with a virus. These are the cells that are actually handling those things. But typically speaking, who are the immunocompromised? Number one, it's the people who are medically induced into being immunocompromised. So who are these people? Well, specific types of cancer treatment can make you immunocompromised. But the other thing is a lot of people who have autoimmune reactions, they will suppress the immune response in order to try to lower inflammation. You don't have to watch very many commercials for different types of autoimmune medications that they say, hey, long-term use is going to lead to the development of cancer. It's not a matter of if, it's just a matter of when. So many cases of being immunocompromised can be due to the treatment for other things. So the other type of thing too is type 2 diabetes. So people who are immunocompromised, many times they're type 2 diabetics. What is the reason why? Well, one of the reasons why is because high blood sugar absolutely will devastate specific types of immune cells, specifically neutrophils as well. So also statin drugs. So just like they said, you shouldn't be on it if you're on a statin drug. And then also cardiovascular disease as well. So when you look at cardiovascular disease, it's not necessarily the cardiovascular disease that's causing immunocompromise. It's just that what you are doing that's also damaging the immune system is also leading to cardiovascular disease as well. But the underlying cause of all of these three different things is actually inflammation. So medically induced, it's inflammation. Autoimmunity and cancer, inflammation. Type 2 diabetes, inflammation. Cardiovascular disease, it all comes down to inflammation, which here in the United States, we are so chronically inflamed. We are so undernourished and so chronically overinflamed, and we're also overfed. So we're undernourished, we're overfed, and we're chronically inflamed, which is a recipe for chronic illness and being immunocompromised in the first place. So here's my question, Pfizer, here is my question. Please answer this question. Will patients be thoroughly checked for contraindications? Will they be thoroughly checked? Will they get an immune panel done, a full immune panel done? Not only that, but will you go through if they have non-alcoholic fatty liver disease? What are their their liver enzymes? Where are they at? And then, and on top of that, that are specifically with clearance of a medication. But not only that, are they on a statin type drug? And then the other question I have to ask is are there other antivirals with a longer track record of safety and efficacy and also have a lot better cost effectiveness? Are there other antivirals with a longer track record of safety and efficacy and also cost effectiveness? See, people ask me all the time, well, what do you think about this antiviral? What do you think about this that can work as an antiviral? And I say, hey, as long as it can put out a fire and has a long track record, I mean, put out the fire and then let's figure out why you needed the fire to be put out, and we'll rebuild the body after that. Because obviously the reason why we go live so many times is we're trying to help people prevent from needing the fire department. If we can do that, great. Some people, they're not going to listen. They're going to need the fire department. But please don't use the fire department to try to rebuild your house afterwards. They just don't do that. They don't have the knowledge. They don't have the skills. In the Wellness Way, we have the knowledge and the skills in order to help you rebuild your house after the fire. And remember this, is that the average dose for treatment of this runs about $530. Okay? $530 is what it costs. That is a lot of money for a treatment, I believe, which is just for 5 days. And the other question I asked too is hey, are there natural antivirals that are safer and more effective. So there are other things that actually can act as an antiviral that can prevent the replication of a virus within a cell, okay? And the answer is yes, there is. So one of them is actually known as licorice, okay? Now this comes from PubMed, National Institute of Health, and the Saudi Journal of Biological Sciences. And a lot of these things aren't done in the United States, and you could probably guess why. And it says identification of phytochemical inhibitors of SARS-CoV-2 protease 3CL from selected medicinal plants as per molecular docking, bond energies, and amino acid binding energies. Basically what they said is they're saying, are there antivirals that can actually work to prevent the replication of this virus? So here's actually what they said, is they did a meta-analysis, and they said the PubChem database were used for the analysis of SARS-CoV-2 protease and plant source terpenoids. The active ingredient is known as terpenoids, okay? So these phytochemicals have the capacity to inhibit 3CL protease, and the one that is actually doing that is known as licorice, okay? So licorice, which, guys, by the way, a lot of times we will give people licorice, especially when they're dealing with a reactivation of a chronic virus, like Epstein-Barr, for example, in order to, number one, try to lower viral load, because the reason why they got the virus was because they are immunocompromised. So sometimes you have to work on lowering viral load and at the same time working on trying to increase the immune response at the same time, okay? So with all that being said, this is the question that I will always ask, is what do we do and why are we doing it this way? Because what we do with healthcare is we work night and day to try to weaken the environment to an already weakened individual. This is what I will always say, this is what I will always fight for, is this. Why don't we instead strengthen the person to be able to withstand any environment? See, this right here, weakening the environment to a weakened individual, this is everyone gets a metal healthcare, which means we're going to try to make the environment weaker because we're already weakened. Which means that everyone has to wear a mask. Everyone should get a you-know-what, an injection. And so we're always trying to weaken the environment. And as a result, we have a lot of people with weakened immune systems. We have a lot of people who are weakened physically, who are weakened as far as their immune systems. And they are so weak, yet we've done nothing in order to try to strengthen them to be able to withstand the environment better. It's almost like as people get older, they say, my knee hurts, I'm going to use a cane. Well, my knee still hurts, I'm going to use a walker. My knee still hurts, I'm going to use a wheelchair. And now I'm just going to be bedridden. And you know what happens with that? Rather than say, let's figure out what caused this, let's work on strengthening you and keeping you independent for as long as possible. And this is what we do. Strengthen the person to be able to withstand any environment. That's the difference between everyone gets a metal healthcare and within the wellness way healthcare model. That's the difference between the two. See, a lot of times when I see people, they're like, man, you don't accept any excuses. And I'm like, I would never do that to you. What I demand from you is to start strengthening the person to withstand any environment. It may be tough, it may be hard, but guys, name one thing that comes easy, that is worthwhile. And we need to start strengthening people to withstand the environment and quit trying to weaken the environment to an already weakened individual. We are not, by bailing people out all the time and not demanding, hey, you need to start getting yourself stronger. Hey, you need to start getting off sugar. Hey, you need to start moving your body more. Hey, you probably should get to the gym. Hey, maybe you should put that food down. Hey, quit inflaming your body. Hey, quit staying up till 2 in the morning, trying to wake up at 5 in the morning, thinking that it's okay. Hey, maybe you stressed out or stressing out way too much about things that don't matter. All of those things are going to weaken the person, and I can name 1,000 other ones as well. But we need doctors who are saying, let's make you strong again. Let's make your immune system great again. Let's make your body strong. And let's make disease as inhospitable as possible to be able to exist inside of your body. And let's honor what God put inside of our bodies. Let's honor what He gave us, and let's make it as strong as possible so that any virus, any bacteria cannot thrive inside of your environment because you're strong again. Hopefully, guys, that makes a lot of sense. And if you agree with that, make sure, guys, you give me a thumbs up, and make sure also that you share this video, okay? Now, I go over this a lot with people, especially when I'm going over their initial blood work and their initial testing. As I say this, no matter what is happening, I will say this. There's good news and bad news. The good news is this. You have 100% say in how you want to heal and recover. And the bad news is also this, is that you have 100% say in how you want to heal and how you want to recover. I am not your savior. I'm your tour guide. If you want to save yourself, essentially what you have to do is that you have to become a different person than the person that got you sick. And this comes down to looking at ourselves very hard in the mirror and saying, you know what, I caused this. Now, I might not have done it on purpose. Maybe I was given bad information. Maybe I had a bad doctor. But I was the one who caused this regardless because I made the wrong choices. And in order for me to get out of this hole, to dig myself out of the hole, I cannot be the same person that got myself sick. And too many times, people are trying to make changes with their lifestyle, but they're still the same person that got them sick in the first place, which is why if you have failed in the past, because you never became the different person that created the problem. And trying to do that might get you for about a month, but you're going to go right back to where you were before. And that's why I tell people the biggest changes you can make is the one that you need to make between your ears, and you need to become a different person that does not accept excuses anymore and only accepts results. And that can be a little bit tough for people to be able to take in. But just remember this, at the end of the day, you can only have two things. You can have results or you can have excuses, but you cannot have both. So this is why, guys, one of my passions is actually working with men, because you know what? I was that person, about 12 years ago at 33 years of age, in absolute terrible shape, low testosterone, sleep was terrible, and I thought, well, one day I'm going to make a change. One day I'll do it. I'm young, and that went along for a long time, and then finally at 33 years of age, I flunked my life insurance test at 33 years of age, and I thought, well, that's impossible. And they said, labs don't lie. And it was that I decided to start making a change and start taking 100% responsibility for my health and for my future, because I realized no one's coming to save me. Doctor's not going to save me. Medical advancements aren't going to save me. We already know by now that that hasn't happened. The only person that can save you is going to be you. And immediately I became a different person and changed my life. And this is one of the reasons why, guys, if you are from the Chicagoland area, please register for the Man Up event July 23rd. And we will show you exactly, here is what you need to do in order to change your life. And it's up to you to become that different person, because I'm going to tell you something. Your kids are relying on you. They depend on you. Your grandkids, they depend on you. Your wife, your spouse, they depend on you. And the world needs men at their best and not some kind of stripped down, watered down version of it. And we're going to teach you how to become the best version of yourself, not only with nutrition, but with fasting, with how you should be exercising, with mindset, and how to regain that spark and that vigor that you had when you were 20 years of age, but you lost it. And the reason why is you lost the gift that was given to you because you abused yourself. And yes, I understand that life gets in the way, but guess what? Your health doesn't care. It doesn't care if life is busy, because it only accepts results and never reasons. And so we're going to teach you, this is how you handle this. Even if you do have a busy life, you can still get these things under control. And this will be an awesome experience. So please make sure, guys, that you go to the top of the page and you register for this event. I promise you it will be worth your time. We'll also go over what to do, what you need to do for the 4-week challenge for those people who are ready to answer the call. And also we have some other options that you can do for quick testing on how to measure certain things very quickly, like your insulin, levels, your testosterone levels, your inflammatory markers, and these are things that you actually do at home that we will be revealing for the first time, your ability to be able to do that at the Man Up Challenge. So I look forward to you guys seeing there. And coming up for the next couple of weeks, I am going to be talking about some of the biggest things that inhibit testosterone production and some of the tips that you can do in order to start changing that around. So spouses, make sure that you tag your husbands or your significant others about that, because I'll give them some valuable clinical information regarding to that. But the information doesn't change lives. It's the application of it, which is what we're going to be doing, obviously, at this event. So guys, I am off. I am 24 hours into my fast, which means I have another 48 hours left to go, but I'm going strong. I'll keep you guys posted how I do, and I'll also keep you posted when I break the fast that I'm doing right now with Dr. Patrick Flynn. We'll see who can last the longest by fasting, all right? Please make sure you share this video. Thanks again, guys, for joining me, and we will see you very, very soon. Be well.